All right, so this is our next person. Her scar tissue is actually healed so much better. You can almost hardly see her scar. Do you have pictures of when you first had surgery?
Somewhere. Not easily. I can send them to you.
If you find, I just need one because it would be because it was.
It went from here to there.
See, you can't even really see. Okay, I guess you can barely see. Yeah, because I remember the incision. I was remembering this part, but yeah. So if you have a picture, that way they can do it before and then they can see it after. Because now, have you been to one scar class or two? I don't remember.
I think just one, but
just
you
one.
did personal work on it too. I don't know how much. I don't think you did scar tissue work. I think you just did functionality work. Like I don't think there was.
Right. Yeah, but I think you had 2 or 3 people working on you that day, though.
Yeah.
Yeah, I mean, so you,
So I don't know. Yeah.
So you could tell once we get her before pictures, we'll show you that because you can barely see. I mean, if I really retract the tissue, you can see where the scar was. And the only thing you can see is maybe a little bit there. So again, we're just gonna do a quick assessment where I'm gonna run my finger. So I still get a little drag there. And I get a little drag there, which is very common over joints where that tissue gets stressed to get drag spots. And again, the technique's not any different on new tissue or old tissue. So we're going to go through and just kind of work our way. A little rough spot in there, which is common around joints because it gets stretched. We can see a little bit how it gets a little pink around those edges, so we're going to go through and work that area. It's healed very nicely.
Yeah,
I'm impressed. Yeah, whoever was working on it last time did a good and thorough job.
You taught them well.
Well, that's my plan. My plan is to teach them well. My goal is to let people realize that scar tissue is an option. Oh, something right there. It might have been an incision. It's a little pinpoint.
Yeah, they let the stuff dissolve. So I think at some point you're right.
Yes, eventually if you truly get this side bridged to that side, it'll actually just go away. Yeah, but it's sometimes that little line that people get, sometimes that doesn't go away, but apparently on a lot of yours it's so, I mean, it's just so light. It's still a little line, but it's
Very noticeable.
But I've even seen some people where that little line goes away after, enough work. Okay, so on hers, I'm mainly just going to go through and do some scouring. Of course, over the joints is where I notice it. Okay, and since hers is on her wrist, we're going to go through and double check to see. Which this one I haven't done any before. New stuff. We're going to go through and see if there's any meridians we need to address with it. Which this is a much more advanced technique. But I'm just going to check her pulse points for water, wood, and fire. Check deep. So where that's at's affected the wood, which is liver gallbladder. So there's a point. It's actually more on the palm. I'm going to hold that point for our governing and conception vessel. Ooh. Can you feel that? Okay. See if we get that to reset. Because the reason with wrists and arms, I guess why I always check that is there's we can access all the meridian points in the wrist.
Interesting.
You know, so with the last person that she has a big incision up here in her arm. I was like, I know that's affected the pulses in her wrist.
Are those organs up here?
Let's see, liver, gallbladder, yeah, right side. Well, the liver is it's biggest on the right side, but it can go all the way over to the other side. And then the gallbladder is kind of behind that side. Feels like that's kind of smoothed out, so I'm going to go back and check those points again. For water, wood, and fire. So the fire still feels a little off. I know it doesn't make any sense, but I'm going to hold the point on her opposite hand. Because fire does affect our heart, small intestine, but it also affects adrenals, thyroid, and the reproductive organs. You're feeling a little dry. What do you think about primrose oil?
Okay. Sure.
I think that would be a good. Well, look, it's actually snowing outside. Little baby flakes.
Yeah, it's insane. It was sleeting then snowing. In the oil form or the capsule form?
It doesn't matter. You can, however you want to take a capsule's fine. It's pretty easy to swallow. But everything I do is for educational purposes only. It does not replace medical care. I am not a doctor, a lawyer, a therapist, or a psychologist. Just, yeah, covering all the bases. Do not try this at home.
Do not try this at home?
Yeah, do not try this at home. So...